Right, we're bang on 10 o'clock. Do you think we should start, Carl?
I'm just looking. We haven't got Helen or Joe on the call at the moment, so I think whilst you're talking, Vicky, and introducing everyone here, Joe's here now, so probably worth just giving another minute and just perhaps covering the logistics of signing in, etc.
Yeah, I think we're hoping to get a nice number of us on the call today. So obviously, if you introduce yourself in the chat as you join in, and any questions as well, and we'll keep an eye. I'll try and keep an eye on the chat function as we're going through. We've only got an hour this morning. We're recording, and we'll obviously make this available for people to access, as Carl's already mentioned. And we'll just remind you again towards the end, if you are not already part of a regional network or on the network and sharing forum, pop your email into the chat if you want a copy of the slides, and we'll make sure we get those across to you. Okay, right, we're a minute in, Carl, so I shall make a start if that's okay with everybody. So good morning and welcome to the second network of users for Infographics. Some of you may well have been on the first network. If not, this might be your first session that you join in for. So for people that don't know me already, I'm Vicky Patel. I'm the chair of NQICAN and also Deputy Clinical Effectiveness Manager at Sheffield Teaching Hospitals. Carl, do you want to introduce yourself at this point for people that might not know you, though I think everybody probably does?
I don't know about that, but yes, no, thank you, Vicky. I'm Carl Walker, Clinical Audit Manager at Leicester University Hospitals, and I was former NQICAN chair for 6 years before Vicky. So welcome everyone on the call today, and I'm looking forward to the session. We've got another couple of speakers that we'll introduce when they come and talk at that time. Thank you.
Yeah, thanks, Carl. So yeah, quite excited to get started. We've just got the hour, as we say. So we appreciate not everybody will be able to join us. So obviously we will make it known how to access the recording for people that do want to log in basically and listen to what we're all sharing this morning. So talk to people already about using the chat function to introduce yourself and ask any questions as well. We're going to start with an introduction where I'll just set the scene a little bit, and then we'll go on to look at some examples by users that have agreed to join the network this morning and share with us how they're already creating infographics for their work stream. There are a number of different software available out there, and it's probably just worth acknowledging that at this point we're not promoting any particular software, and you do need to go away from today and see what's available and also what your own organisation is happy for you to use in terms of information governance. We will move into the opportunity, like we've said, to have a discussion and ask any questions as well, but by all means use that chat function. Okay, so 2 minutes just on the background of NQICAN in case we've got anybody joining us today who's perhaps not up to speed with NQICAN and its common purpose. So professional network of colleagues undertaking clinical audit, first founded in 2000, originally under the name of NAG, some of you will have known it by. We meet on a quarterly basis. We consist of the regional network chairs, officers and non-officers, alongside co-opted members with the aim of representing all types of health and social care organisations and providing a voice on behalf of their teams and patients in improving patient care. We've got 12 regional networks that cover a vast number of organisations that provide care to patients. If you're not yet registered in your regional network, have a look on the NQICAN website, find out who your chair is and get in contact with us or the chair directly. We do have an nqi.can1 at nhs.net email address where you can contact Sarah, Becca or I if you're interested in joining the networks. If you are already a member but you know other organisations that aren't, give them a nudge, get them invited to join as well. Alongside that, we've got our network and sharing forum, very active. Our regional networks have got space on that forum as well, so you can go onto your region and you'll be able to look at minutes, agendas, presentations, etc. Lots of threads and topics on the forum as well. If you're not yet a member, again, go to the website or email us and we'll let you know how you can actually join the forum. lots of threads and topics that you can get involved in. You might be able to answer people's questions. You might want to post questions yourself. Lots of sharing of tools, etc., that goes on there. We also send out regular newsletters, one from the forum every month to all the users that are registered, and also a quarterly one to our regional networks. So if you're also then registered within the network, you'd receive that cascade of information coming out of NQICAN as well. So we do have a common purpose, and today's session is in full support of that, helping us to deliver on this. And this is about us making sure that we support all of our members really to deliver high quality projects that are helping to improve patient care as part of our local programmes. Behind the common purpose, we've got our forward plan. Vast number of initiatives sit on the forward plan, and we pull out our key priorities each year to focus on. But again, that is helping us to drive improvements at a local level with the aim of improving patient care. And today's network of users of Infographics directly supports this. So what do we need to think about then when we're using infographics in clinical audits? So we've already got a high number of national clinical audits who present outcomes using infographics. We're looking at different platforms now where you can produce your own infographics. You can download your local data for some of these national clinical audits. So we now need to be engaging more of our teams in using infographics in this way.
Sorry, Vicky. Sorry to interrupt. I seem to have Phil and Joe's slides have come on my screen.
I've not got their slides. Has somebody taken over screen sharing?
I think so.
Yeah, it looks like Joe has.
Let me come and take over again and come back to my presentation. Is that all right?
Well, it's good to know we've got Phil and Joe's slides. Thank you.
Okay, can you see mine again now?
Yeah, we can. Thank you.
Lovely, thanks for that, Carl.
No problem, Joe.
So who do we need to target then after today's webinar so that we can actually now start to change our approach for clinical audit to make more use of infographics in presenting clinical audit information? Think about your clinical audit teams. For those of us that are working in clinical audit, this is our very own teams, our facilitators who are working with the frontline teams. We've got our clinical audit leads who are responsible for supporting clinical audit in their area. We want them to share and learn from clinical audits more widely. And if it's really important to audit, then it's really important to share and learn about the outcomes and next steps. We need to engage those senior clinicians in this way of thinking who will most probably welcome this, as they need accurate information to enable them to make informed decisions for making those changes to patient care and services, or for sharing more widely the improvements already made that have really made an impact and a difference, because we do need to celebrate the good as well. And then we've got our project teams, and we need to refocus their mindsets to look further than just collecting that data and evidencing the so what in a really creative, informative and concise way. So what do you need to consider then for report writing or producing a poster? So in your own organisations, agreeing that template for reporting, maybe that 1 or 2 page summary using infographics, maybe agreeing a poster template. You might want to look at agreeing colours and logos to align with your own organisation. So you've got that branding. Go back and have that discussion with your organisations about finding that suitable software that they're happy to resource and use. And then it's just about taking care when producing infographics of data. As you select the right chart for presenting back your data, it's the same principles applying when we're using infographics as well. And then sharing and networking, successes and challenges, helping others to see how they can present clinical audit information to actually enable more wider sharing and learning and celebrating. And then finally, just thinking about that reporting to board. How can you change the way you present your clinical audit information, progress and performance to board using those infographics? So it's about starting to think differently. Our audiences still need an accurate and timely reflection of the data and information over time, highlighting successes, challenges and concerns, but they don't want that thesis anymore. They want this short summary report, 1 to 2 pages, key headlines of what they need to know, and pictures can tell an absolutely great story, use less space, they're more aesthetically pleasing, and they're often remembered and recalled more easily. So what key points do you really want your audience to take away from reading that report, that poster, or even that slide? And that's your project outcomes. It's the progress maybe against your audit programme. It's your team's outputs in your annual report. So it's no different from when you're report writing, really, just taking time to think about your message, who's your audience, time to think about how you can use this information to meet multiple objectives. So you just want to produce it once and use it multiple times, present your project outcomes, include it in newsletters on websites, in your annual report, even in your quality report maybe. So at this point, I'm going to hand over to Carl, who's going to look at sharing some tools and resources with you and calling upon some of our users to share examples of how they've already incorporated the use of infographics into presenting information in the world of clinical audit, but also to highlight, we're 3 weeks away now from Clinical Audit Awareness Week. We've been waiting for it to come, obviously with us not holding it last year with clinical pressures, and it's thinking about now with your local plans as well. You're still 3 weeks away, so actually you can still get some information out there using infographics to the wider audience within your organisations, within your regions, within your ICSs as well. And then, as always, as we do at NQI Can to plug things and advertising, Clinical Audit Awareness Week itself, we've got the Lunch and Learns running Monday to Friday, 12:30 till 2. The links are on the forum. They've gone out on Twitter. We'll be sending more comms out. You don't need to register. You just need to click the link on the day and come and join us. And we've got 5 categories across the week. Monday is focused around patient safety and clinical audit. Tuesday is patient advocate and engagement for clinical audit. Wednesday is how do we influence change when we've got that data in our hands. Thursday is looking at a really topical topic at the moment around health inequalities. And then Friday, to end the week, we're looking at future-proofing healthcare. So we're looking at sustainability and how clinical audit can really help us to make that difference as we move forward. So please, please, please do come and join us, but have a think about today's Infographics Network session and how maybe you can take some information and tools away from today to actually use that in Clinical Audit Awareness Week within your own organisations. So I'll hand over to you, Carl, if that's okay. I'll stop screen sharing. I think you're on mute, Carl, at the moment.
Yep, thank you. And it's good to see we've got Helen on the call as well now. Morning, Helen, because Helen's one of our speakers this morning. Great, and Joe's here as well. So I've got 10 minutes just to follow up from the last session that I gave as part of the first meeting we had for our infographics network. And really that was really just to try and strip it back a little bit, like Vicky's just been saying about how we try and make data count in terms of making it simple. Obviously we've done plotting the dots with quality improvement to try and make sure that we learn from that, and plotting the dots is a form of infographics. So what I was trying to look at today is actually think about how the human brain works and how we can actually get our messaging out there and make it a bit easier to succeed, because we've a lot of competition in terms of pressures on our clinicians and lots of other messages that they're being sent. So and I'm going to use expertise that I've called upon to try and summarise that in the 10 minutes that I've got. So here we go. So can you see the slides all right, Vicky? Great, so I've already introduced myself, so I'll move that on. I mean, I've used the UHL slides today in terms of background, but this is just really my experience that I'm sharing today, not necessarily clinical, anything to do with my trust. But so yeah, so the first thing would you like you to do, please, is how many sheep are in this picture? And when you do it, think about what process you've done to find that. You can post it in the chat if you want. I'm not going to. It's not one of those where it's. I've been watching 1% at the weekends, and it's not. There's no trick behind it. Although there is a black sheet to try and put you off a little bit. But so hopefully you'll all have come up with a conclusion that there's 4 sheep in that picture. How many sheep are in this picture, please? Okay, So that's a little bit more complicated, but hopefully you all come up with a number there. And again, thinking about how that was different to the previous picture. Obviously, because I'm behind slides and we haven't got that much time, I would like to speak to people, but as we've been recorded also, I won't ask anyone to be brave. But ultimately, when we talk about, are we experts in numbers? A lot of us might put our hands up to say, oh, I've got a stats degree and things like that, or I've done maths at school or whatever, I'm quite good at numbers. But actually, when we look at experts in numbers, none of us are expert in numbers. Nobody really understands numbers in terms of the human brain. Our brain can only deal with numbers up to 5, really, and then after that, it's lots. So going back to the 2 pictures I shared, when you saw the first one, instinctively, you don't need to count. You'll see that there's 4 sheep on the slide. But on the second one, as it was more than 5, you would have actually had to count the 8 sheep on the slide. There was no way your brain could have just looked at that picture and without counting come up with a number. So and again, that's one of my take-home messages today, is actually lots of us in the room, lots of clinicians, lots of expertise on the call today. We all might think we're experts, but actually the human brain is not an expert in dealing with numbers. So and the higher our numbers are, the less sensitive we get to them, and that's called numbing. So one of the great sources of interest that has helped me understand this better is this book called Making Numbers Count. And again, there are other books available, but ultimately I think this is a really good resource. Our library have actually bought this and I've borrowed it, but I'm just going to share a few points from this. So if anybody was here on the last session, they were talking about how to make emotional connections with data. So the standard way of presenting it was like livestock are responsible for 14% of global greenhouse gas emissions. But if you do it a different way and said that actually if cows were a country, they would actually be the 3rd highest producer of greenhouse emissions among all nations. So again, that, if you look at the 2 different ways there, you're much more likely to remember the right-hand side of the screen than the standard way that we present it. So, and again, there's a lecture there in terms of how he's gone through that in terms of that. So again, that'll be on the slides. But here's another one that I thought was interesting. So no brand attached here, but a 300 like a can size serving of cranberry apple juice has 44 grams of sugar in. So unless you've dieted, you probably wouldn't contextualize what that meant. But actually, if you look on the right-hand side, the Making Numbers Count translation is the equivalent of 3 Krispy Kreme donuts and 4 sugar cubes. So again, having that translation in terms of what 44 grams of sugar actually means to people that generally can understand more about what sugar is, then you're much more likely to think next time you have a juice, how many grams of sugar are in this? Because I've actually been on a diet this year for health reasons, and I've been looking into this, so that certainly resonated with me in terms of doing that. And interestingly, now as part of the Healthier Nation, all restaurants now put how many calories are on the restaurant when you're on a meal and things like that. So again, that gives you also a different look at how numbers translate into reality. But infographics aren't new, and translating data into meaningful translations isn't new. And I said at the last session, Florence Nightingale was the first person to use infographics. Well, she actually used data translations as well. So again, here's some dry numbers about how many troops were died in the Crimean War. And because those numbers are really high, you think, well, actually, that's lots of big numbers there. I can't contextualize that. But actually, she said, 600 out of 1,000 troops actually died. And again, just chunking that down even further, that's 6 out of 10 troops died. So again, if you look at the dry statistic, you wouldn't have much of a take-home message there, apart from lots of people clearly died. But here, if you put it in bite sizes, 6 out of 10 troops died. And obviously we can translate that to our outcome data when we're looking at our improvement projects and looking at patient outcomes. So bringing it to a bit more modern day, this was a modern day example of 30,000 people out of 50,000 who died involving coronavirus actually were disabled people, according to the Office of National Statistics. So again, that instantly is quite a lot to interpretate and process, but actually you can actually see that there's a lot of people dying there that actually were disabled. So what Health Watch at Bristol actually shrunk that down and made it into a translation to actually say 6 out of 10 people who died from COVID last year actually had disabled. So again, that's and then they put it up with a proportion below it in terms of backing that up. So again, that's making conversation there. People can actually take that away and discuss it. And an alternative way, again, what we can actually do is actually make it even more meaningful by turning those 6 people into wheelchair providers. I know there's other patients that are disabled that aren't in wheelchairs, but ultimately, again, that's getting people thinking in terms of how the data translates and trying to get your point across. So yeah, so the bit of a wordy slide here really, but ultimately these slides are going to be shared afterwards, but this is my summary from a sort of detailed long book. But the more we can make it closer to the human experience, the better we are likely of touching people's to actually get their attention. And it's getting the decision makers' attention that we need to do in terms of clinical audit, where we have got lots of interesting data, but it's actually what are the key data points that we want to share, and actually how do we need to make that data root in people's minds and actually gets them to actually translate that into meaningful action to make a difference. And as I say, I think we do need to do that a lot more in clinical audit. We're very good, we're experts, but sometimes we're blighted by all of the data that we've got. We've lived and breathed the data, and we've come and we want to present in front of clinicians who are very educated. So we feel like we need to make it as complex as possible sometimes, but actually the data is saying that none of us are experts, and we just need to make it as simple as possible so that we've got a better understanding, and those analogies or comparisons and a different dimension of looking at things will actually translate it into discussions and actual action. So yeah, and ultimately that is what an infographic is. Infographic is a graphical representation of information, data, or knowledge that you want to try and present and share so that people can understand, and you get a story from it in terms of what you've done. So yeah, so that's just a reminder. Vicky's already covered that, but about saying using clinical audit to drive improvement, and it is not clinical audit and quality improvement. It is clinical audit is just one of the tools in the quality improvement toolbox. Just a quick a freebie flag. I've now got 365 in our trust, and there's lots of infographic templates in PowerPoint that you can actually use. So again, if you're lucky enough to have been upgraded, then when you go into the templates, just go to infographics and then look for the templates, and they're the ones. There's lots of good ones that you can use, as well as finding out what's happening out there. They're the same tips as I shared last time. Again, we'll go through that at the end in terms of the next steps, really. So thank you for listening, and we'll now introduce our next speakers. So, and again, we'll have time for questions and the like afterwards. But hopefully, that's try to make you think differently about how you do your own analysis and how you present the data, because we spend an awful lot of time doing detailed analysis, but we don't do much time in thinking about the comms that we do to share that beyond the project team, really. So next, can we welcome Jo? I know Jo's ready with her slides because we saw them briefly earlier, and Phil as well. So are you? Who's doing the talking? Is it Philip or is it Jo?
Phil, do you want me to start off, or?
Yeah, if you start, Jo, and I'll chip in. Please.
Okay.
Okay, so well, over to you then, Joanne. Thank you. And Yeah, okay. And as I say, if you're not comfortable with sharing, we can always cut out anything afterwards. So just, you know, that's great. All right.
I just need to find the slides again. I was struggling a little bit this morning.
Okay, well, we have got them if you want us to share them for you.
I think that'd be better. Have you got them to share, Carl? If not, I can. And then we can see people as well, can't we?
Yeah, yeah. Becca's got them. If Becca, you're happy to put them up on the screen, please.
Thank you.
Well,
They're coming.
yeah, thank you. Yeah, that's all right. I just want to make sure that you, because I know we've had one or two people trying to struggle to join the meeting again. So you've been helping with that, haven't you, Becca? Thank you.
Oh dear.
Less
So
than
thanks
last
very
time.
much for inviting us again. Sorry, I noticed the date's wrong. I haven't changed that on these. I did make a little bit of a change from last time. So yes, that's myself and Phil. I'm the Clinical Audit and Improvement Manager at the Christie. I do have an "and" in there, but I know it shouldn't really be. It is, so it's just easier to say. Phil is the Patient Experience and Improvement Lead for the Trust. And actually he's done a lot more on the infographics than I have, but I've just put these slides together, so I'll go through them. If you could have the next slide. I'm not trying to recommend necessarily any particular software, but the software that we've used at the Christie is PictoChart. So I've just put a couple of slides to show you what it looks like when you go into it. And obviously you can go and have a free trial yourself and have a rummage around, but this is basically what it looks like. And you can start off with just these, where you pick a template first of all. There's loads of templates in there. Interesting to hear that it's also in PowerPoint as well in 365. Thank you for that little tip, Carl. That's really useful. So that's one way, and I think that can work quite well if you just want to use some styles that people have already got. But if you're quite comfortable with it, and I guess the more experience you have, you can actually use the other way, which is on the next slide, with the design elements, and that allows you to be a lot more creative and start from where you'd like to, basically. I don't think there's necessarily one way that's better than another, but maybe it's a bit easier to start with a template the first time you have a go at it. Okay, so then I've got a couple of examples. First of all, we've used it for posters. There's a couple of posters here, a PALS one that Phil did on the left, and one that I've recently done around the climate emergency and some of the SUS-QI tools that are available, which I'm hoping to promote in our trust. So this one on the right was a template, because I thought the colours worked quite well for the health emergency, and that was pretty quick to put together. So I think hopefully they work quite well as posters. The next slide shows an example of results from patient survey, which Phil's been involved in.
Joe, would you like me to talk around these?
Please do, Phil.
Yeah, absolutely. Hi, I'm Phil. Hi, as Joe said, I'm the Patient Experience and Improvement Lead at our trust. So we've used PictoChart just probably for a couple of years now, and we found it really useful for giving results back to our patients. So I've just put a couple of examples here. So the first one on the left is the National Inpatient Survey. So I'm sure most trusts, well, all trusts do take part in the National Inpatient Survey from an acute trust point of view. There's a huge amount of information in that survey, and it's not usable for patients to get feedback. So we do a quick summary chart using PictoChart to give results back to our patients. So the one on the left is our chart. It's kind of developed into this standard kind of chart now. So every time we get national inpatient or national surveys, we do a chart of this type, which we then display in wards and areas for patients to see a summary of the results from those national surveys. The other two, so the middle one and the one on the right, are two examples of our own in-house survey results that we feed back to patients. So we do regular trust-wide surveys of patients, and it consists of quite a lot of questions and probably too much information just to generally feed back to patients. So we've now produced these standard looking patient feedback charts. So you can see here, these are examples from outpatients. So these charts are some of the latest surveys that are taking place in those areas. And the department areas then produce posters of these, a larger size, and display those in the clinic areas so patients can see their results. We hope it's quite visual for them. We say the good and the bad, and hopefully it's easier to take this information in than it is with just traditional kind of graphs and charts. We've had good feedback particularly from staff in the area, that they really like it as well. They can see their results, and we've had a positive response from this way. Once we've done one in Pico charts, it's really easy to change the data. So when we resurvey, it literally takes just a few minutes to copy the data into the graphs and charts that are already embedded within Pico chart. So it does literally take 5 minutes to get these surveys ready and out to the ward and clinical areas. So that's just a couple of examples of what we do for patient surveys. That we haven't kind of got a standard template or a kind of corporate way of doing things, but it seems to have developed into this kind of blue and white approach, and I think that's because I kind of like that colour. So that's some examples. Perhaps if we move on to the next one, the next slide, and I could just talk about this one a little bit, if that's okay, Joe. So from a more trust point of view and a clinical point of view, I'm sure maybe at your trust, at our trust, we do a huge quarterly report that covers patient experience, that covers patient safety and incidents, and covers clinical audit and quality improvement, Joe's aspect of it. And I think at the moment that's probably running, or it used to run, about 80 pages long. It was huge and unwieldy, and people didn't really read it, we felt. So what we do now is that report is split into 3. So there's patient experience, incidents, and there's quality improvement. And we kind of do a summary of each of those sections. So for each of the 3 sections, an example here, the patient experience on the left is basically all the information that's detailed in the other 20 pages are summarised on this one page. It means that people at committees who are very busy and have hundreds of papers to read can literally flick to the infographic chart, look at the data and get a feeling for what's happening, whether that's in patient experience, whether that's in risk and incidents, within a few seconds. The other data is in the report, and if they wish to drill down and look at that data, they can, it's there. But the feedback we've had, most people just look at these charts now and get an overall feeling of what's happening. This has been a massive step forward for us. I feel it is hugely useful in getting the important information across to people in those committees without them having to troll through the whole lot of data. It also means when the likes of myself and Joe are feeding back at committees that we just concentrate on this one page and we don't troll through all the other data. So we just literally go through this one page and that's it. In the past, we've trolled through 20, 30 pages of data and just people get lost with the graphs and charts and can't take that information in. So this has been a massive step forward to us, and this is probably how we're going to progress going forward with reports, particularly where it's data heavy, that we'll use a summary infographic. I've also thinking about producing this for patients as well. So we have information in clinical areas, and so we'll probably take that forward. We need to feed back to our patients what's happening, not just in patient experience, but also in clinical audit, in clinical improvement, in incidents. So this is our approach to feeding back information quite succinctly to patients, hopefully. So that's that one. Perhaps, is there another slide after this one, Joe? Oh yeah, do you want to do that one, Joe?
Yeah, I don't particularly want to dwell on these ones. It was just my attempt a couple of years ago to do our annual report, and I pulled out a few of the key themes for people. I think I probably could do better than these ones, but particularly the left one is the one that was shared mostly. And then the one on the right was more about showing people the key differences in the divisions, which we didn't actually get that much feedback from any of the staff. So we have tried quite a few different approaches to the annual report. But I don't know if you get feedback on yours. It'd be quite interesting to know if anybody does. But generally speaking, I think just the brief headlines is the best thing, because people don't seem to have a lot of time to be taking in the detail of some of these things, unfortunately. So,
yeah. And I think just I can interrupt there, Joe. I think Joe does herself a disservice. I think it's about trying these things, isn't it? And we're not graphic designers. We're not experts in designing these kind of posters, but we know what information we want to get across to people. So I think it's a case we just, over the last 2 years, just give it a go and just try this way of presenting data to people. It has evolved, and we have become a little bit more savvy and a bit more used to using PicoChart now. So the things we produce now are probably a lot better than they were 2 years ago. But we just give it a go, because this is to us a tremendous way of getting data across to people. And myself and Joe are picking up those skills now in how to design things and how to make them look nice and appealing to people. But that's just because we just give it a go over the last 2 years. I think that's all I've got to say, Joe. I don't know if there's anything else or questions and comments from people, or we're leaving that to later, Carl.
Yeah, no, I think well, first of all, let me give you a virtual clap, and there's lots of claps coming up on the screen, so that's really good. And I agree, Phil. You've done really well here, both. So don't be downbeat, and it's great that you're sharing today, because everybody starts from somewhere. We're all on a different journey with this, and again, it's all just doing little PDSA cycles, isn't it? And starting what worked well, what didn't do it well, and refining it really. And again, we've got comms teams in our trust, haven't we, that are also perhaps experts in this type of thing that we can pull upon, as we touched on the last session. So yeah. So is there any questions? I can't see any hands up at the moment, but there's one or two complimentary comments coming in the chat. Rebecca Newton, thank you.
Hi there. Thank you for this. It was really interesting. I was going to type my question in the chat, but I want to say, do you submit a full report with the infographics? Because I'm really keen to take this on with my quarterly reporting, but we have quite a comprehensive report we do. So I was just wondering if you also do that as sort of part of it, or if it's in place of. And then also, have you used this for the quality accounts? Because again, I'm really interested in that as well.
Okay, should I start there, Joe? From the point of view of the quarter report, we start, I don't know how many pages it was originally I started, probably hundreds of pages literally. We trimmed it down to about 70, and now, yes, we still, the report's about 40 pages long, our quarter report, but the infographic is at the start of each section. So the infographic is part of the quarterly report. We still have that data there for people to look at, so all the SPC charts are in, all the narratives are there for people if they want to drill down into that. But the start of each section has the infographic. Ultimately, we'd probably like to get rid, I don't know, I've been a bit ambitious here from a joke and comment, but we'd like to get rid of most of that other data and just provide 3 or 4 infographics for people. That's a big shift in culture, and I think that's what I'm trying to aim for from my point of view. The data is always there, isn't it? So Joe has data set up on an ongoing basis that people can access via our Trust's website anyway. But yes, it's part of the current report, but we hope to trim that down so that we just end up with infographics.
I think some of us touched on this in the last session, and what we try and do is make the detail available, but not necessarily have to have it. So it's like putting people off by reading it by saying it's 100 pages. So if you can get your infographics and have hyperlinks within that, then I think that's probably best practice. So people still perhaps need the detail, but not everybody. And so again, it's much more likely to grab their attention if they realise that they're the key bits. So okay, great. Any other? Rebecca's just saying thank you. That's she liked that approach as well. So Okay, any other hands, or should we go to the next speaker? As I say, we'll have a chance for further discussion at the end. But okay, well, we'll just thank you both again there for excellent sharing. And the thing about these sessions is that the session is over at 11, but we are all there to help each other beyond that and use it to the forum and on social media and the networks. So yes, that's great. Okay, so Helen, are you okay now to share your slides, please, for the next session?
Yeah, okay.
Excellent, I can hear you fine. Yep, and I can see your slides as well now. Great, Helen, thank you.
No, that's not the right one.
Okay.
Not sure where that one's come from. Let me try again.
But whilst Helen's loading up her slides, Helen used to work in Nottingham before she moved to Yorkshire Trust, and Helen was actually part of the forum testing group that helped us develop the forum. So thanks, Helen, for your input on that, because the testing was obviously good, because it's now nearly 4 years old or whatever it is. So yes, thank you for your input on that, and thanks for sharing today.
Okay.
See your slides fine.
So as a starting point, our trust actually has from our communications team, we actually have a colour palette which we're supposed to use with any communications within the trust. So within my infographic work, I tend to use this as a guide, and it's kind of a hindrance and also a help as well, because in some ways it takes out the pressure of what colours to use if you're actually using a specific colour palette. But on the other hand, it can also be a hindrance as well with working with certain infographics. So it kind of works both ways, really. But it's also really helpful to use so you don't get any arguments with comms about not the stuff that you produce and going out and it's not in the trust format, etc. So it'd be worth, if you don't know already, it'd be worth looking within your own trust to see if you do have anything like this. We also have guidance around which types of fonts you can use as well, again, which can be a help because it kind of takes the pressure off knowing what you should be using. So this is an example of one of our infographics. This one was done for the Deaf CAM service, which we manage within the trust. And this project was mostly around risk assessment, and it was kind of 3 main areas really, with the most sort of comprehensive, the one that had the more standards, more criteria to it, was clinical letters. So we kind of made highlighted that part in the middle, so it kind of stood out a bit more. So trying to make it stand out more, because that was the main part of the project, and the other parts of the project which are at the top, the SAMP stuff, most of those were 100% anyway. So yes, it was good to highlight that practice, but the main areas for improvement were about the clinical letters. So yeah, it was trying to make a point of those really. Also, we added at the bottom about the re-audit needed a bigger data set, because that was one of the limitations of the audit, so we thought it was good to put that in as well. And also we put in a little box with the actions which were going to come about from the meeting, just a little summary so people get a feel of the whole project. So within our trust, it's not just in audit reports that we use infographics, we also use them at other stages as well. So this is an example of a methodology for a project. It actually came from a service evaluation, and this was done during the COVID outbreak. and there was quite a lot of different work streams to this project. There were 6 in all, and there was a lot of stuff involving staff, service users and carers, so it's quite a wieldy methodology. And when the lead came to me to see about making something a bit more visual, the information they had, it would take up nearly a page and a half of text, which a lot of people ain't going to be bothered about reading. So my brief for this really was try and make it a lot easier to understand. So this actually went into the main report as kind of a separate piece on its own. They said, yeah, just to explain the methodology for a project, and it was, yeah, as I say, it was very complex. They used a lot of stuff like interviews, surveys, they did observation work, so it was kind of breaking it down really, so it was a lot easier and a lot quicker for people to get their head round. This is a more recent summary that I did. This was for our annual report for last year. So this was produced in, I think it was March time. And we just wanted to show the kind of summary statistics from our audits activity, and also our NICE stuff we do for NICE as well. And in that sense, also show off the work that we're doing with data viz and also infographics. So this one was a concept that I was working on with regards to an audit where looking at self-harm within inpatient units, and I'm just kind of thinking a bit outside the box really, and trying to put a different spin on things. So using a photo of an actual environment and then putting the information into that environment, so then people reading it will get that association. So such as 27 the self-harm incidents involving use of ligatures. So I kind of attached that to maybe something using the door handle, or about the contact with wiring and plug sockets. So it was just really sort of thinking differently and how you could put this information across, but in a really kind of a different format that people maybe wouldn't expect. And using a similar sort of concept with this, this was part of a bigger project, and this was around the service users' coping strategies for COVID-19. So this was part of an evaluation project where service users were asked what they did to help themselves manage their mental health issues, keep them well during the pandemic, what kind of things they did. So we had a lot of sort of text data, and there was a lot of work went behind that with analysis, grouping into categories, etc. And again, it's just kind of thinking outside the box and putting it into maybe a bit more of a context, so people would grasp it better than just have loads of charts. This might engage people a bit more. This was another one that we used within the COVID outbreak, and this came about when the figures were published regarding the risks for people who were within the BAME community, and it was just to highlight really the sort of the higher risk that were involved with various ethnicities, and also the numbers of health and social care workers who were also affected by this as well. And with this one, we actually added some QR codes at the bottom as well with the data sources that we use. So if people wanted more information, or if people wanted to check out the sources, they could do using the QR codes. It's a quick and easy way for them to do that. So we've also worked with other departments within the Trust, namely our patient experience department, to produce some infographic information for them as well. This one was from a project they did regarding the impact of health and wellbeing for service users and carers, and this was regarding the carers experience. and this document was something which was going to be read by members of the general public. So it was kind of keeping it sort of quite not easy to read, but not very jargon based. It wasn't clinicians that were going to be reading it, so the general public would rather have something, you know, more visual, less sort of techy, less complex. So it was kind of getting that information across. There was quite a bit of qualitative information in this as well with regards to people's experiences. The team were quite keen to get people's actual comments and phrases actually put into the work as well. And this was another one from the same team. This one had a lot more of the quotes, etc., from the service users that they wanted to add, because then they felt as though their voice was being heard. So again, it was kind of how to get that across with not just having reams and reams of text, making it more engaging, making it more informative, but also bearing in mind that the end user is probably not somebody who's going to be very au fait with the use of charts and statistics, that kind of thing.
Everything okay, Helen? You've come out of your presentation at the moment.
Yes, that was it.
Oh, brilliant. Oh, well done. Sorry. I thought you might be bringing up another presentation, but yeah. Excellent. Well done. I don't know if you can see while you're presenting, but there was lots of hearts and claps going on as you were presenting, and lots of great feedback in the chat as well. So well done. Excellent. We've actually got one or two questions before we open up the hands up in the chat. So one or two people asking about where you get the great images that you use. Is that in this software package that you use, Helen?
Mainly I get my images from, it's actually an online website, and it's called Flat Icon, and we've paid to get a premium subscription, but you can get a free account and you do get access to a lot of icons from there. So it's worth, yeah, just signing up for the free account. You do get quite a lot and you get a lot of downloads. The only difference with the free account is that if you use an image from there, you do have to you know, put a little reference in the document to the image that you've used. Okay, but generally, yeah. I put mine at the bottom in very, very small text, so it's on there, but it doesn't, you know, it doesn't clutter with the image too much. It doesn't derive, you know.
Great. Do you want to take your stop sharing your screen now, Helen, and then we can see people as we're talking as well? Thank you. Yeah, so I think also the new PowerPoint 365 have got lots and lots of icons and images and things that you can change colour and everything. So I think definitely technology is going to be on our side for doing this going forward, without a doubt. So okay. What other questions did we have in the chat? Yeah, so lots of positive feedback in terms of the QR code. You showed QR codes. Does that take you to the full report, Helen? Someone's asking.
Yeah, the ones that we used, they would take you direct to the web page, which had the raw data on it. I think a few of them were government related, some were Department of Health.
Yeah. Okay. Brilliant. Yeah, because we've used QR codes in our trust now to start pointing people to guidelines or patient experience leaflets. So they are definitely really useful and something to consider when we're trying to get our messages out. Okay, let's see Layla's hand go up there.
Oh, you.
Hi.
Can't turn the mic on. Just want to ask how long these infographics take.
It varies really. The one I did for deaf cams, that could maybe take a couple of hours. The patient experience ones generally took a bit longer because it was kind of a to and fro with the patient experience, just to get to get feedback from them. Then it'd come back and maybe do a few more amendments, and then it'd go back again. So it was kind of work in progress, really. So yeah, it's not like you're doing it constantly. You maybe do a couple of hours, send them a draft, and then they come back and say, oh, this works, this doesn't. And then you're sort of to and fro for a couple of weeks.
Phil's got his hand up now, Phil.
Yeah, thanks, Carl. I'd just like to comment, Helen, your infographics are excellent. I'm going to steal the idea of having a background. I think that's really good. So that'll be on my next infographic. I think a comment on time as well. Same for Helen, sometimes it can take an hour if it's a quick one. The patient experience ones that we feedback on surveys, there's a standard template, so that only takes 10 minutes. The thing about I've learned from doing the infographics, and I find it better to know what data I want to present. So if I've got a lot of data, to have already picked out the items I want to present on the infographic and kind of have an idea in my own head of how I want to present that, and then I'll troll through the pictures to try and find something appropriate. So it can take as little as an hour, but like Helen said, sometimes it can take quite a bit longer, particularly if you are liaising with somebody else and doing something on somebody's behalf, because they always have something to say, no matter what you think how good it looks. They have their own opinions of how they want it to look. But over time, I think our skills have increased, so we can kind of produce some really quickly now.
Great. And I think we're just about to talk about the next meetings, but Melissa Piper sounds like might be a good one to invite her to next meeting, because she's just saying about 30 minutes that normally takes her to do her infographics. And again, probably got a template. I don't know if Melissa wants to just quickly add to that, but it sounds like you do it standard practice for every project now.
Yeah, I do now. Well, I thought they were nice, but my leads think they're good, but I'm not sure they're quite as up to your levels that we've seen. But yeah, they love them. And they look forward to receiving them now, because it's the way they can share their work that they've done and be proud of their audit and show what they've achieved, but also where they need to improve. And they're great, but there's certainly areas we know we can improve, because like you say, we're not graphic designers. And the first ones that we did 3 years ago were massive, and now you're getting them down to an A4 and the information that you need. So, like you say, it's just developing as you go. But I'm happy to share what we've done.
Thank you, Melissa.
Don't mock me.
But, and again, that's why it's all we're here to share and learn from each other. And again, adapt, adopt, or discard it. Not everything works for everywhere. So, yeah, great. So I've just put in the a link in the chat where we've got a section in the forum now where we can where we share all the videos and the slides. And again, what we're trying to do is, if you've done something that you're proud of or whatever, then please share it. Perhaps you're not confident enough to put it on social media or anything, but as with any sharing, we always ask for respect for people to treat that information with the sort of professional integrity, etc. But again, if you do use their template, please take the time to feed back to that person, because it's being respectful, isn't it? But also it'd be nice that actually they can see that their sharing's helped someone else, because that's the main reason I do the networking and sharing, is actually just to learn from others, but also share what we've got ourselves, sort of thing. So yeah, is there any other questions before I go back over to Vicky to wrap up? No? Okay, then Vicky, so you've got a couple of minutes to wrap up and perhaps just point people to what's happening in 3 weeks' time, again, like you did at the start for those that were late to join us. Thank you.
It's good opportunity, isn't it, Carl, to plug Clinical Audit Awareness Week again. That was an absolutely fantastic hour, and it's so lovely to see what can be produced, because I think if you're only just dabbling your toes so far, it just enthuses you to have more of a go, really, doesn't it? So I know I'm going to take quite a bit of that back to my own organisation as well, to try and enthuse people. So I think it's just a recap really on, yeah, go away, give it a go, sharing on the forum, as Carl's just said, because you really need to see what somebody else has produced to just give you that nudge, don't you, to start getting creative. That was really good seeing the methodology presented and the actions as well. rather than just very much focused on putting those outcomes, the data into infographics. It's really good to see it all the way through. So that was a really good example. So thank you for sharing. And I'm looking forward to seeing Melissa sharing as well, maybe at the next one as well, just to give you a little nudge of encouragement. So yeah, so encourage you to go away and start producing or sharing more widely if you're already doing it as well. And just think about what types of software. That's so good to hear about Office 365 as well, Carl, as we're all upgrading, because it's there for us to use, isn't it, as well? So yeah, last minute really before we wrap up then, yeah, Lunch and Learns 13th to the 17th of June, run by NQI CAN. Key speakers have now been announced. I didn't tell you the key speakers when I talked about the topics, so really quickly we've got Josie O'Heaney, the Medical Director's Clinical Fellow from HQIP on the Monday. We've got Kim Rozelle from HQIP joining us to talk about the patient advocate on Tuesday. Sam Riley is helping us with our webinar on Wednesday about influencing change from NHS England and improvement for the Making Data Count. And we've got Caroline Rogers from HQIP, one of the directors, joining us for Health Inequalities on Thursday. And then James Mountford from the Transformation Directorate at NHS England and Improvement on Friday for future proofing. So we've got some good names there. They're going to be sharing the good work that they're doing and giving us some top tips to think about where to go over the next 12 months leading up to Clinical Audit Awareness Week next year as well. There you go, Carl. I'll hand back to you.
Okay, so the last bit of housekeeping was, as I say, we will share everything on the forum. If you're not a member of the forum, please put your email address in the chat and we can send you a link to the forum or also the slides, whatever you prefer. I think it's 3 months since our last meeting, Vicky. I think to keep the momentum of this going, I think we'll have another meeting. Certainly there's enthusiasm here because we've not really done too much publicity on this, have we? And we've got over 50 people on the call today, so that's really good because it's a Monday morning as well. But it's quite difficult to get dates in the diary where everyone can make, so we'll try and do that quite soon and then make sure that most people are aware. But like I say, we'll share this and cut it up like we did last time. So again, we won't put the chat in there or whatever, and just put little case studies so that people can take time out and learn what we've learned from colleagues such as Helen and Joe and Phil. So which is great. So okay, so if there's no other questions, thanks for everyone's time, and keep networking and keep doing the good stuff out there and promoting and improving patient care. So well done all. Thank you.
Thank you, everyone.